Hello, I am urologist Omer Erdamakaya. Today I'm going to give you a short video presentation about what Primobolan, Triptorelin, and Decapeptyl are. Primobolan, namely Matenolon, was synthesized in 1962 and has been actively sold in the world since 1965. When it first appeared, it was utilized in a wide range of fields, including providing motility in adults and the elderly, preventing muscle wasting, combating weight gain, and elevating blood levels in children. As time passed, its popularity dwindled in those fields and it gained favor among anabolic users. As a result of this shift, the company decided to withdraw the drug from the market. Nevertheless, it has continued to be produced in a handful of countries, including Turkey. Illicitly sold across the globe for years, even counterfeits are being manufactured. Primobolan stands as one of the priciest anabolic substances available in the United States. Primobolan's anabolic and androgenic scores are lower than those of testosterone. However, its popularity stems from several key factors. Firstly, it does not raise prolactin levels, nor does it convert to estrogen, which means it does not lead to gynecomastia. Secondly, it does not convert to dihydrotestosterone, although it belongs to the dihydrotestosterone group, resulting in weaker androgenic effects and fewer side effects. Finally, women can also use the drug. These properties have made Primobolan a popular choice among users. Of course, the famous athletes saying that they use this product, and the showing that famous athletes use this product as doping in the media have increased its use. So what harm does it have? Compared to other anabolics, its androgenic effect is weak. At normal low doses, it does not seriously affect LH-FSH levels. But anabolic users use high doses, like 600 to 700 mg per week. Normally, the treatment for this is 100 mg every 15 to 20 days. But when 600 to 700 mg per week is used, it is 20 times more than the normal treatment dose. Of course, in this case, it definitely suppresses endogenous testosterone in the testicles. It suppresses the hypogonadal axis. After discontinuing Primobolan, the patient's testosterone, LH, and FSH levels drop. Apart from this, it significantly increases the impacts and side effects of other anabolics used along. For example, when used with testosterone derivatives, it can cause clot formation in the veins. It can cause clots in the cerebral veins, which we call cerebral venous thrombosis. It can also do this in the legs and arms, and it is an acute condition. It has serious consequences. There are many case reports on this in the literature. There are cases who come to the emergency department with vascular occlusion. If the patient also smokes and does not use fish oil, he may have problems. The user must take this risk. As I said, it is a substance whose impacts and side effects are well known. There are so many videos about it. Other than that, what kind of substance is Triptorelin Decapeptyl? Since Pregnyl is not on the market, Decapeptyl is a popular substance among anabolic users. Anabolic users of Pregnyl use this one for post-cycle purposes, increasing testosterone levels upon LH effect. Normally, this drug is used in the treatment of prostate cancer to completely neutralize testosterone, or it is used to prevent the increase in the number of eggs hatched in IVF. Here again, LH-FSH is neutralized. It has one side effect that anabolic users benefit from. It increases testosterone levels by creating a strong LH effect in the first 10 days of its first dose. In the following days, with continued doses of the drug, it completely shuts down the system and neutralizes the testosterone. That's why anabolic users usually use 1 to 2 doses and stop using this drug. Because Pregnyl is not available in the market, they have to use this. But as I said, continued doses are risky. I do not recommend using these drugs in any way, whether Primobolan, Matenolon, or Decapeptyl. In fact, these are not even drugs to use under the supervision of a doctor. The reason and the purpose of use are obvious. Thanks for listening. Best regards.